Now, as we continue discussing the advantages of globalization and its impacts to the world and to the rest of the globe, the rest of the world. Now, this time we're going to focus on globalization, its impact on the environment. One of the things that we have to also bear in mind is because of globalization, there is a big drive for raw material to be obtained from developing countries. And most of the time, those countries with power, big machines, deep pockets, go to some of these countries with raw material that they need, either bribe or convince those people that it's okay for them to forego some of their natural resources with the hope that this might help them to also have some resources to develop. Unfortunately, some countries have really had the negative impact. You think of Sierra Leone some years back, wherein we had the blood diamond. Certain countries in the West went to Africa, particularly Sierra Leone, with money, with guns, in some cases with drugs. Use some of its inhabitants to fight each other while their natural diamonds were being exploited. And this has been an ongoing fight in some of these developed countries. Also, not forgetting about the corrupt leaderships in some of these developing countries, where resources gotten from some of these Western powers are not adequately used for the development of their respective countries. When you talk of the climate, you think of the Amazon forest, the level of destruction that is going on. And you think of so much wasteland that has been created. So, yeah, the environment has gone through a lot. And at times, for the productions of some of these either minerals or takeaway of some of like forest and wood, timber, has left people with no farmlands. Say in this country, in some areas wherein you have the coal mine, after so many years of mining coal, now the place is abandoned. How best can that place be used again? So globalization and the environment is a massive threat to the environment, causing both environmental and health damage. Damage the environment, taking away farmlands, and even in some of here in the states, you have some farmlands that have been bought by big corporations to build houses. So now those farmlands that people used to grow their crops, it's gone. Building houses that with some years to come, those people cannot even afford to live in. And you think of the go to countries, extract certain chemicals, petrol, gas, which gas is one, petrol is one of those biggest hydrocarbons that really contributes to climate change. And people living in those environments experience some issues with respiratory issues, in some cases, even drought. So it's a challenge. Some aspects of globalization and the environment, there, there are some ways that it could be advantageous. But the present way in which it really exists, it in most cases it does very little. Say for instance, like now, okay, in some developed, like smoking in America is becoming something that is frowned upon. It's no longer that sexy kind of habits that people used to. But it doesn't mean that the cigarette producers have stopped producing cigarettes. What they've done is just, okay, some Western countries are cutting down. So let's take this to developing countries, sell it to them. So what happened? After a few years, you have a lot of heart diseases, lung diseases, and possible cancer-related illnesses. And even when it comes to food, what food do we really take to other areas? So globalization is a massive threat to the environment because deforestation has increased. We've lost most of our forest to serve the needs, in most cases, of the wealthy. Say like, okay, the Amazon used to be one of those places we are in, so considered sacred. certain things were in some of the trees, some animals lived in, the species. Now we're losing so many species because their habitats have been destroyed. Again, these are all, instead of this idea of cohabitation, some is just, okay, we take your environment, we mess up your environment, and with time, we eliminate you for the benefit of the wealthy. And also with the support of those in power in some of those developing countries for their own personal interest. Globalization contributes to climate change in several ways. For example, as a result of increased travel and pollution, see, depending on where you live, population has increased and there's also increased need for travel. The air emission that planes, when they fly, or certain plants wherein coal is used, because there's an increased demand for energy. And in some cities wherein you have too many people with too many cars. Luckily, when it comes to cars, there are moves that people are trying to improve the air pollution and also trying to convert their energy source from gas to electricity. But it will take a lot. And from even and powering our houses, some people are beginning to use the solar system, use of the sun to produce energy. So there are better ways, people are becoming scientists again, thank God for scientists, people who are always thinking of better ways to make things better so that we might stop hurting ourselves for some of this short benefit, but long-term pain. And again, Wilson argues that new environmental threats are energy through complex and extended pathways that are global in reach. Global inequality. There are massive inequalities globally in relation to health. Massive. Say, even right now, as we are talking about COVID, we are talking here in America about people not wanting to take the vaccine. In other countries, they are talking about not having the vaccine. See the difference? Here, we are getting to the point wherein it's people's attitude towards the vaccine. It's not that the vaccine is not here, it's here, but people's attitude. Now we have to spend time convincing people to take the vaccine. For developing countries and others, they are praying that they get the vaccine to treat their population. Why? Because in developing countries or countries, a country like America, there is the resource. They know how to develop those vaccines. In developing countries, the resources are not there. And most of the time, they don't have the capability to be able to develop those vaccinations in a timely manner. Big gap. Right now, India is faced with a big challenge with her population being hit the most at this present time, asking for masks, asking for all those resources that here we have a lot of. But in India, because of the size of the population, India, in terms of intellect, is highly advanced country. In fact, the sad part of it is globalization has really created some kind of slight imbalance because a good number of doctors, scientists, and if you trace their origin that are now in America providing quality service are product of India. So globalization has also created that brain drainage or brain drain. So then you have, despite economic growth, large variations still exist across the globe in relation to life expectancy. Yeah, overall, there has been some positive in terms of economic growth. But for some people, they have to pay a lot more for that growth than others. Say, for instance, now people who have to endure the smoking habits, yeah, they bring money. They get money from the taxes and whatnot. But what happens? People die younger because of respiratory related issues. Yes, some of this food stuff that is being exported to some of these places bring money. Yeah, but people later on die due to obesity, excessive drinking, and all those issues that were once not so much an issue. The developing countries used to still be dealt with infectious diseases as the leading cause of death, even though in some areas it's still part of it. But now is both the chronic conditions and also infectious diseases. So most of some of the diseases that were mostly from the West are now part of the diseases that are also affecting some developing countries like sub-Saharan Africa, in addition to infectious diseases. And again, when you think of the power of research, how many How long did it take for people to be able to develop this vaccine? Didn't take that long. Something that used to take 3, 4 more years took maybe 1 year or less. And how long has malaria been killing people in developing countries? And still up to today, still there is not a vaccine for malaria. So most of the time, with globalization, most of the time, where the researchers and those people funding those research varies, because if they're going to make money, a lot of it, they will spend nights and days working on some of those things. But if they are not going to benefit so much from it, most of the time, it's very, very difficult. That's why most of those diseases that were once considered, oh, by now they should have already been eradicated because of the power of research, they are still problematic in developing countries. So the global inequalities create those situations wherein some people really benefit highly from globalization at the expense of others. Because rich countries can go to developing countries, get some of the raw material for cheap, develop those material, and if they want, they send them back to Africa or some other countries at a much higher price, and they profit the most and leave those countries with the destruction that goes with mining, extraction of certain things, or the pollution that is related to things like smoking. And yes, now there's also even the possibility of certain drugs in some countries. And you think of the textile industry, those people working in some of these textile stores for minimal price to tell us some of these things that people in the West just take for granted. See, some people really, as globalization continues to advance, I think there's also room for equity. There's also room for fairness. There's also room for justice for those people who are engaged in producing some of those things that are shipped to the West at a lower cost and at a much more higher cost for those countries developing them, even though they are paid. But when you think of the advantages, it's very, very minimal. The relationship between income and health is complex, with those living in high-income countries tending to experience much better health and life chances than those in lower-income countries. Those people living in higher income countries have a lot of flexibility in terms of choice of food, availability of food, choice of, and access to medical service, and also dealing with some issues wherein it comes, well, how to deal with conflict. Most of the time, conflict does not easily erupt into wars. In in countries that were low income countries, usually because of lack of resources, at times lack of good education, it's very easy for people to erupt into wars, destroying each other. There's a level of people are not sure of the food insecurity. Again, there is a lot. Everything being normal, I think. Every country has certain resources that they can use to really use properly. They will be able to help their population. But unfortunately, most of the time, most countries, even though they have natural resources, those raw material, don't know how to, or don't know the know-how, how to get them to finished product. They are sold for cheap and are left with the destruction. So most of the time, their health outcome is usually poor. And now, again, when you think of industrial waste, where are some of this waste being deposited? Some of this waste, especially from developed countries, most of the time we run out of landfills. So where are they deposited? Some of these things are taken to countries with low income. So increase their problem. Not only do they have less healthy resources, now you're adding more pollutant that will mess up their seed produce and other challenges. Global poverty. Poverty and powerless that is associated with it negatively affects the health of those experiencing it. Most of the time, poverty and powerless, those are two negative. You poor, most of the time you don't have power. You don't have power, most of the time you don't have better ways to take care of your population. And most of the time, you don't have the means to even support your population. So that you're dealing with you have some people who are overall country as a country. They might be poor, but some country says things like North Korea. North Korea, when you think of their population, they might be experiencing some level of poverty, but they are not powerless because they have some resources that they can use within to develop weapons that they can sell to other countries. And in return, be able to take care of those in power. So it's complex when it comes to discussing issues that really affect the impact of global poverty. Why is it at the 21st century we're still talking about global poverty? Extreme poverty is the most serious cause of disease, with 70% of death in developing countries attributable to 5 causes that can be easily and cheaply combated. Easily and cheaply combated if they have the resources, if they have the capital. Pneumonia, antibiotics, diarrhea, malaria, measles, and malnutrition. You think of prenatal and natal malnutrition of infants as well as grown-ups. These are all diseases can be easily and cheaply combated. These are diseases in most cases have been taken care of. Some years, say, and some years ago, people will die in America because of pneumonia. Now it's very, very hard for somebody to die of pneumonia because there's cure. Diarrhea, no, there's cure. Malaria, it's very, very difficult because there's cure. There is a way wherein it could be treated. Measles, it's vaccination, and malnutrition. Children, grown-ups, adults, a better way of providing nutritious food for them. Even though once in a while you hear some of these outbreaks and this is, but it's usually quick. They put it off. But in some of those countries, these are very occurrence. In fact, when COVID hits in some of those countries, you don't know whether the person is dying of pneumonia or it's the COVID, or dying of diarrhea or malaria, or both. So there is a lot more when we talk of globalization. A lot has been done, but a lot needs to be done, especially when it comes to diseases. As long as the disease still exists in the globe, no part of the globe is safe from the disease. It's just a matter of time. If we've not learned anything, COVID-19 has taught us a lesson. You ignore one area because of the disease, you can call it whatever name. Call it the China virus or whatever name. It will kill your people if you don't take the necessary precautions. Plain simple. So if we want to stay healthy, we want to reduce some of these challenges, we have to make sure that we reduce the global poverty. And we also do all that we can to make sure that some of these things that are diseases that can come from other countries, we stay prepared. Prepared with the right message, with the right attitude to treat some of these diseases. Because if we don't, we will also succumb to some of these health and challenges or some of these diseases. In 2001, the death of 2 million people could have been prevented simply if they had been given access to uncontaminated food and clean drinking water. In 2001, people are still drinking contaminated water. You can transpose that to even 2020 or even 2021. There are still people, even in developed countries, that have access to contaminated food, though lower in number, completely lower in number, and clean drinking water. Think of Flint, or whenever there is flood, too much rain contaminates drinking water. People have to be told, don't drink your water, boil it. Or there are certain times wherein people in some of those food service areas, convenience stores, buy certain things that are not the most healthy. And just imagine for developing countries. Women and children bear the brunt of global health inequality. women and children, the role of that maternal. They take care of children. And at times in some countries, the women are the last to eat. Husbands eat first, then maybe the children, then the wife, the mothers. See, these are things that have to, these are cultural issues that have to stop, because women, they take care of the family. The healthier the women, the better it is for the family. You show me a healthy mother, I will show you a healthy family. See, because some of those things have to really be stopped. In 2007, women made up of 61% of HIV infection in sub-Saharan Africa. Why should this be the issue? Why should they be? Part of it is poverty. When women are poor, they are willing, not necessarily willing, they will sacrifice themselves for sex, paid sex. And some men are not responsible enough to put on, wear the condoms properly so that they can protect the woman as well as themselves. And some men will say, if you don't allow me to have sex with you without a condom, I'm going to someone else. Take my money to somebody else. So what happens? They agree. And they affect themselves. They become infected. If that male has HIV, he passes on that HIV to this uninfected woman. And if in the process the woman becomes pregnant, well, hopefully now there are certain key treatment, but also increases the chance for that child to be infected. If you don't take the necessary medications that will prevent the child to be infected. And most of the time, the attitude of men to have multiple sex partners increases their chances of being infected and infect a lot of women along the way. Within all societies, death rate are typically highest among the poorest. Well, that's just common among all societies. The death rate is usually highest among the poorest because they cannot afford medical service. They cannot afford healthy living. They cannot afford access to good food. They live most of the time in polluted areas. All those social determinants of health, they experience them at the negative end. And yes, when you do not have good food, you do not have access to good mental services, your environment is not good. And most of the time, because of some of those conditions, you engage in certain behaviors. The likelihood of dying young is very high. Poorest, has the highest death rate in societies that are poor. The global burden of disease is disproportionately experienced by those in lower income countries. The burden of disease, the challenges, the prevalence of disease. Some of those countries, especially developing countries, they have to deal with just schooling, having clean water, having proper medical services to be able to treat. Then comes disease. Yes, it has more because the resources are in most cases not there. Or if they are there, they are not properly used. By those in power. Higher death rates in poorer countries. Africa accounts for the majority of HIV infections. Not only are the numbers of infected people, individuals, unequal across the globe, the implications of short diagnosis always vary massively according to locations. Those in lower income countries have more negative outcomes. See, poverty in itself is, the unfortunate part of it is, it's very easy for people to just make, okay, because people are poor, therefore things, it's not that, poverty makes it a magnet for people to engage in behaviors that is going to be detrimental to their health. It's not that because they are poor, therefore, no, it's the poverty. Most of the time, low income education, low education, poor socioeconomic status, poor nutrition, a lot of wrong messaging. Because usually what goes on in some of those countries is wrong messaging. People don't really try to create the connection between the HIV virus being transmitted through sex or intravenous use is what causes HIV that will later on develop into AIDS. Instead, they will try to use all sorts of explanations. This is a witch stuff, this is not this. See, unfortunately, that is the same nonsense that some people have succeeded in introducing into the COVID virus in America. Oh, it's not this, it's this, it's that, this is something that It's who is this? Gates has developed to introduce chips in people's body. They really see at times we have to be able to use the right type of information that is guided by science. Maybe if people in Africa, a good number of people know that you have sex with somebody who is infected with HIV and that person ejaculates into your vagina, you have a chance of contracting HIV. So most of the time, it's a much, much higher chance because of the duration of that infected semen into the woman's body. And because of the conditions, probability for infection is very high. And some studies have shown that some men have been fortunate to have not been infected by having sex with a female who is infected. But again, it's a very small study, and therefore the best thing is nobody should have, nobody that knows their health status should have sex with somebody without using protective means. Children die every day from preventable diseases like malnutrition, diarrhea, gonorrhea, not gonorrhea, diarrhea, malnutrition, and measles. These are all preventable diseases. Malaria. These are all preventable diseases. Malaria is a huge global killer, infecting one child in Africa every 30 seconds. See, I'm one that just by the grace of God, I would have not made it because I had a bout of malaria almost every month. But somehow, at times, if you believe in God, God has a plan for all of us. But I have lived in Sri Lanka and see kids dying out of because of malaria. Infectious diseases remain a large global problem. The infectious diseases. Now we have the antibiotics. Why can't we use those antibiotics in a proper way? Because also in developing countries, there is also the issue of in developing countries, they don't have the antibiotics. in developed countries, they abuse the use of the antibiotics. So one does not have, so leads to poor outcome. The other has, but does not use it properly. It leads to poor outcome down the road. Because for developed countries, when antibiotics is overprescribed, then it creates the ability for the bacteria that is about to be treated to develop a resistance. Then you have a new strand of that bacteria. So that antibiotic that used to be able to take care of that bacteria is no longer capable. So two issues. One is lack of, the other is lack of proper use. Can both be problematic. Okay, Kaufman argues that figures are simply abstract because it is impossible for most people to grasp the fact that 15 million people die as a result of infectious diseases every year. You talk of global financing and healthcare. Poorer countries have far less money available to spend on healthcare. Less developed healthcare infrastructure, staff shortage, and in many cases, lack of basic supplies of drugs. And when you compare to what a country like America spends, it's way, And most of the time, Africa also, and some of these developing countries would rather spend some money in buying weapons in place of training more people, having the developed infrastructure than buying weapons to keep those people in power. Low income countries and health service provision. Say people in low income countries tend to have far less access to modern technology and adequate health care, and are often reliant upon donors' aid to provide health care. This is what is happening right now with this COVID. Low-income countries are now hoping that the developed countries will help with providing vaccinations and some of these resources, more or less, say the leftovers, to help take care of the health of their population. So healthcare system found in some lower countries do not perform well. 35 of the 50 worst healthcare systems are found in sub-Saharan Africa. 35 out of 50 worst healthcare systems are found in sub-Saharan Africa. Again, the resources and also the priority of some of the leaders. You see, because if the priorities of the leaders are They are really committed to serving the health of their population. I think some of those countries in sub-Saharan Africa would be self-sufficient in taking care of their people. See, because some of those are due to lack of resources, some of it is also lack of brain drain because of the sort of governments that they have. And at times, the priorities. What are the priorities? Because for countries to develop, first of all, you have to have a healthy population. And most of the time, having a healthy population do not always rely on the latest technology. Some of it is just as basic as day and night. Clean drinking water, clean food. If you start there, clean drinking water, proper food, good education system. If you start with those three, you can add on. Because lack of clean drinking water introduces infectious diseases. Lack of or insufficient food contribute to malnutrition or people easily susceptible to diseases. Poor immune system. Good education contributes to the development. Good education system down the road will contribute to good governance. Good governance wherein everybody is treated equal, not like a family. People become president, it's the whole family that is president, or their bodies, and this the body system. See, these are some things that, especially for sub-Saharan Africa, it's not all of sub-Saharan Africa that is really in the bread basket for is how are the resources of the countries used. How do we take care of some of the most elementary, basic, clean water, clean drinking water, good, sufficient nutrition, good education? And in some cases, some people might even say you take care of the health of women, because when you take care of the health of women, they will take care of the health of the family. And see, those in power should stress some of those things. What is the need? What do we need as a country? And not what at times some of the World Health Organization will say, oh, this is what you need. Because in most cases, some of the dictates of the World Health Organization at times creates more problems. creates more problems because they come up with certain guidelines or certain bylaws or certain things that makes things even worse for the poorer people. Just to meet the most basic of health needs, the World Health Organization suggests that at least 66 billion should be invested in low countries. Financing healthcare is a complex task associated with managing difficult budgets and making ethically challenging decisions. It's the word here, making ethically challenging decisions. Global governance. The forces of globalization have led to an increased range of global policy actors, shaping health policies, funding, and provisions. Many organizations assume a role in creating and maintaining the conditions required for good health and healthcare on a global level. Global actors affect our abilities to improve both national and local health too. Now you have the World Health Organization. So we're going to stop here for today so that the next time we can